Talk about the benefits of vitamin K2 on your health. Many Americans are subclinically deficient in vitamin K2 because the main food source of it is natto, and most Americans don't consume natto on a daily basis. Why should you be taking a K2 supplement or eating lots of nano? Well, because K2 is beneficial in many of the chronic diseases that we see today. First of all, K2 has shown benefit in type 2 diabetes. And what its benefit has shown is that it will increase insulin sensitivity, meaning your cells will be more prone to listen to the insulin signals when insulin knocks on the door and says, "Hey, I have a sweet treat for you." Vitamin K2 has shown benefit for osteoporosis and osteopenia. Studies have shown that the way that it is beneficial for osteoporosis is that it increases the amount of calcium that enters the bone versus entering plaques in your vessels. This is huge for heart disease because calcification of arteries is a big piece of the etiology of cardiovascular disease. So piggybacking on that, obviously K2 has shown a big benefit in heart disease patients. The 10-year Rottingham study that studied over 5,000 heart disease patients showed that when taking high amounts of K2, there was a 57% decreased risk of cardiovascular death in the group with higher K2 levels versus groups with lower K2 levels. That study also showed that K2 levels reverse calcification of arteries. So here's the connection between osteoporosis and heart disease, or the joint benefit of K2 for the two of them. Lastly, K2 has shown a benefit in cancer. Specifically, it has shown to decrease prostate cancer risk or incidence by 30%. And in patients who have hepatitis B or C, in a study they showed that the patients with high K2 levels showed that the hepatitis B or C advanced to liver cancer only 10% of the time versus 47% of the time in placebos. So that's a huge decreased risk of liver cancer associated with hepatitis B or C infection when you have sufficient K2 levels. So this begs the question, what should the daily dose of our K2 levels be? Well, studies have shown that the higher the dose, the better the benefit of K2, and the sweet spot seems to be around 300 micrograms per day of vitamin K2. So when you're looking for a therapeutic dose, look for as close to 300 milligrams a day as you can get. And that's big because not only does it decrease risk of death from liver cancer, prostate cancer, and heart disease, but specific to the heart disease and aortic calcification, it's been shown to reverse it, even if you already have it. So K2 is a powerhouse supplement that most of us are subclinically deficient in if we're not supplementing with it, so this would be one to add to your arsenal.